Hi, my name is Quinn Goodrich. So I would like to practice nursing in a setting that is accessible to lots of different populations of individuals. I would like to work with individuals that are of indigent or not insured status. So really, I wouldn't mind if that was some kind of community mental health center, a hospital that specifically serves low income or Medicaid populations. So really any kind of place that works with this population primarily. So nursing to me is really that role of combining caretaking with patient advocacy and really trying to work with what our patients are telling us. So I believe nursing exists because this role was not being filled by physicians. So I believe that physicians are primarily looking for that medical diagnosis and that cure. So nurses really facilitate the whole process in between coming into whatever facility that the person is seeking care and getting that information and then helping the patient cope with information that their care provider gives them. So I would like to practice nursing because I have experienced the deficits in care and the difficulty of access that lots of populations have. And I really enjoy mental health and substance use. And I've really come to believe that um, mental health and substance use concerns can be apparent in any patient, regardless of what they are coming in, what their primary problem that they're seeking care is for. So I'd really like to work in crisis services because I enjoy the fast-paced environment and really being able to find those resources to give patients. So my underlying beliefs about nurses are that nurses are really patient advocates and should focus on patient-centered care. So I believe that nurses can make as much or as little out of their job as they would like. So what I mean is that nurses can take on more care management roles and finding resources for their patients, whether that be finding the basis of what patients really need assistance with, so possibly housing or medication management or substance use treatment. So really getting the picture of that patient's life outside of the hospital and what those needs are and how they could influence that patient's health. And so patients, I believe, are any kind of person that is seeking help in a medical setting. So really there has to be that willingness for patients to really get that full influence of the care that the nurses can provide, but nurses are also there to provide support and guidance into possibly a better care management situation. And so other healthcare providers, I believe that nurses are really the liaison between patients and healthcare providers. So I think this is a really special role, and I think it really gives nurses a chance to build a lot of rapport and really build that patient relationship so that they can facilitate the relationship between the healthcare provider and the patient. So the four meta paradigms of nursing are person, health, environment, and nursing. So person is obviously very important in my nursing practice because I really do enjoy that patient-centered care and the patient interaction that nurses have. That is really a big part of why I went into nursing. And I've also seen a wide variety of definitions of health for each one of our patients. So I think that it's really important to find that definition for your patient and then be able to express that in a way that other healthcare providers can understand, and that you can facilitate the best care possible for your patients. And I've seen how much environment influences a patient's health because I have worked with a population that is majority Medicaid and homeless. So I can see that these patients can express their needs of how they just really need those basic human needs of stable housing, a consistent food source, just warmth, and so sometimes it can just be really difficult listening to these concerns and understanding that these patients just really don't have a consistent access to these things. And this is a really big issue in the Denver metro area. So that's why it's just really hard for me to take in some of the care planning that patients are given, because it's really not applicable to their lives with how much instability that they have. So just really meeting patients where they're at and really bringing them up for those achievements that may seem small but can really be big in their overall life. And so nursing is really just bringing together the person, their definition of health, and the environment that this person is living in. And so, like I said, really meeting the patient where they are, and just really creating an accessible care plan that the patient really feels like fits their life and their needs. So my vision of nursing in the future is that nurses continue to take on these higher level roles like nurse practitioners and possibly medical directors, and even in healthcare policy and financing, because nurses can really bring that love and care that nursing was built on. And I think that really gives nursing a different perspective than traditional medicine, because it's really nurses are really there for the patient. So some challenges that I may face as a nurse are just all the different issues that patients have with access to really solid health care, and that is a challenge that I'm willing to take on. And so some of my goals for professional development are applying for nurse practitioner school and receiving a doctorate of nursing practice to really make that difference in patients' lives. Thank you.